The purpose of this video is to understand the dynamics, anatomy, biomechanics, and teaching of throwing a Frisbee. The following will evaluate, describe, and teach the Frisbee throw in 3 distinct phases. 1. The loading phase. 2. The acceleration phase. 3. The release and deceleration phase. The segments that are involved for this backhand throwing motion are the torso, clavicle, scapula, humerus, radius, and ulnar. Each of these obtain their own unique rotation during the movement. This video will be focusing more on the upper torso and right upper extremity of the human body. The 3 joints that play a major role are the shoulder, the elbow, and the wrist.
Go.
Part 1, loading phase, involves shoulder, trunk rotation, elbow, and wrist. In the shoulder, we see that the shoulder girdle is involved. The muscles involved are the anterior deltoid and pectoralis major, which are both concentric and cause the action of horizontal adduction. In the trunk rotation, we use spine, which involves the left obliques, which is concentric and is caused twisting. In the elbow, we use the humerus, radius, and ulna. The muscles involved are bicep brachii and brachialis, which are both concentric and it causes a flexion. In the wrist, we use flexor carpi radialis and flexor carpi ulnaris.
Phase 2 is the acceleration phase. This phase involves trunk rotation, horizontal abduction of the shoulder, extension of the elbow with continued flexion of the wrist. The right oblique and right latissimus dorsi contract concentrically to rotate the trunk in the direction of where you want the Frisbee to go. Torque is a major aspect of this motion. Torque is defined as a force that produces or tends to produce rotation. To produce the force needed, one must contract the oblique muscle, causing twisting, which then will assist in the force of release of the action. Next, we see movement of the shoulder girdle. The shoulder horizontally abducts due to the anterior deltoid and middle and lower trapezius contracting concentrically. Finally, we see the extension of the elbow. The tricep brachii and anconeus contract concentrically to extend the elbow. This motion is a first-class lever. A first-class lever is a type of lever where the axis lies somewhere between the force and the resistance. The triceps apply force to the olecranon in extending the forearm at the elbow.
The last stage is called the releasing phase. When understanding the anatomical analysis, the joint actions are the hip, trunk, shoulder, elbow, and wrist. The pelvic girdle at the right hip is concentrically contracting, also known as hip abduction. The muscles in action are the gluteus medius, the gluteus minimus, and the tensor fasciae latae. In the next motion, the trunk is rotating in a lateral direction with the spinal column. The right obliques and the right latissimus dorsi help concentrically contract. The shoulder, along with the shoulder girdle, contracts concentrically while moving in a horizontal abduction direction. This involves the anterior deltoid, the middle and lower trapezius, and the rhomboid. When observing the elbow, the humerus, radius, and the ulna are the main bones, while the muscles tricep brachii and anconeus have a major impact in helping the elbow move from flexion to a fully extended elbow, in other words, elbow extension. The final motion is the wrist. When releasing the Frisbee, the wrist extends and finishes in a supination position. The wrist is comprised of 8 carpals, 5 metacarpals, 14 phalanges, the radius, and the ulna. The extensor muscles, such as the extensor carpi radialis longus, the extensor carpi radialis brevis, and the extensor carpi ulnaris, help with the wrist movement. When addressing the biomechanical perspectives of this phase, Newton's second law of acceleration provides that mechanical advantage. Newton's law is a change in acceleration that occurs in the same direction as the force that caused it. For instance, the force is the arm that causes the Frisbee to change in acceleration.
Recap of all phases. In the loading phase, it's best to make sure an individual's feet are shoulder width apart. In the acceleration phase, make sure the individual throws by using their trunk rather than just their arm. In the releasing phase, make sure an individual's index finger is pointed to the target for best results.